Millions of people around the world die every year because they're unable to access effective and affordable antibiotics. REACT is putting equity at the centre of action against antibiotic resistance. The global network prioritises solutions and political change towards ensuring that all have access today and tomorrow, no matter where they live.
In the heart of Zambia's capital city of Lusaka lies the Matero community. Matero is a densely populated neighborhood where access to basic amenities like water and sanitation is limited. Here, due to challenges of accessing clean drinking water, vaccines and poor sanitation, diseases like respiratory and diarrheal infections are common. This increases the use and misuse of antibiotics in the community and drives the emergency of resistance to commonly used antibiotics, thereby making it difficult to treat these infections. Mavis is part of a group of local leaders working with the global network REACT to teach communities how to prevent infections, which are often a result of poor hygiene practices and knowing what to do when you get sick.
Sometimes you can get sick, you go to the hospital and you stand in a long queue, only to be examined by the doctor and given Panadol, then you're also given a prescription to go and buy. Because of lack of finances, maybe you can get just a half or quarter of the antibiotics.
Mavis and her team belong to the United Church of Zambia and also use music to encourage participation in their hygiene programs.
There are places where you find that they have built a lot of houses at the same place, but one pit latrine. So we've mounted the tip taps. We tell them each time when they're using the toilets, they should wash with clean water and hand wash.
REACT is advocating for the proper use of antibiotics to avoid misuse and overuse of antibiotics in both humans and animals. The inappropriate use of antibiotics is a driver of antibiotic resistance, especially in community settings. REACT is making a difference in communities by creating awareness about antibiotic resistance. Communities are advised to seek medication from proper healthcare professionals rather than over-the-counter. Doctors also warn that antibiotic resistance poses serious health risks for patients and that timely access to effective treatment is crucial.
So I've seen a number of patients that come into the facility with a suspected bacterial infection that is maybe causing diarrhea and fever, which could be typhoid or any other enteric disease. So we found that some of these patients are not responding to the first-line antibiotic treatments that are available and might need to be referred to a higher level facility. So this usually causes a delay in them receiving the effective antibiotics that will actually treat the infection and can end up causing avoidable deaths or complications.
While REACT is also advocating for access to affordable antibiotics, regardless of social status, the network is calling for stricter regulation of the use of these medicines to increase appropriate use of these life-saving medicines.
We actually are a strong voice advocating for ensuring that there is access to antibiotics for everyone who needs them, because that's what our mission actually stands for, that we would want to see sustainable access of antibiotics to everyone, regardless of geographical location or economic status.
REACT is now advocating for functional diagnostic labs so that health workers are able to determine if antibiotics are needed and which antibiotic to prescribe.
It's important that antibiotic resistance actually is tabled as on the global health agenda as we would want to see it. If you look at low and middle income countries, you'll notice that we face a number of challenges, right from the weak healthcare infrastructure. The challenges water and sanitation also further aggravate the problem, where the highest burden of infectious diseases are.
While Mavis and her team say they won't tire of spreading the word about good hygiene practices to prevent disease outbreaks in their community, REACT advocates for increasing antibiotic production within the African region to improve patient access. And REACT's mission is to enable collective action so that people in the Matero community, as well as everyone else, have timely, affordable access to life-saving antibiotics. This is part of everyone's right to health.